So I will hand over to Dr. Ashwani to take this forward and share his insight on the most common chronic diseases, most common root causes contributing to chronic diseases today. Over to you.
Thank you, Dr. Ruhi. Thank you, everyone. Good evening. Thank you so much for taking out time. We appreciate that you are allowing us to share this information with you. Okay, hope you can see my screen. So yes.
Yes, sir.
Most of the chronic problems are increasing. So you name anything, it is increasing.
Dr. Ashwani, slideshow.
So we name any problem, it is increasing. Be it diabetes, be it female issues like PCOS, PCOD, hypertension, hypothyroidism, hyperthyroidism, Hashimoto thyroiditis, issues with the digestive system, for example, IBS, IBD, etc. Also autism. So you name any problem, it is increasing. And whenever you ask a reason, why did I get a problem? Or you ask your healthcare practitioner, why did I get a problem? Most of the time you're told that maybe it's genetic, it is in your family, and you're supposed to have it. Okay. But if you really look around it, maybe your family doesn't have it. In some cases, maybe it has, but in most cases it doesn't have it because it's a recent problems. These are not very old problems. Even though it has been in the past, but it has been very, very rare. The prevalence of the disease has been very, very rare. Out of 100, only 1, 2 could be having it. But today, number of people getting these problems is just even children, even adulthood, even young age, even elderly. Every age group is affected. Not, these chronic problems, you're supposed to be in the elderly age, but this is affecting a young age also. So we can fairly squarely say that it cannot be so much a genetic problem that has happened to us in the last 30, 40, 60 years. Okay, there's no evidence to prove that human genome have changed. Something else might have changed, but human genome fairly remained constant, which means if genes are remaining constant, what else is triggering the problem? There has to be something beyond this genetic theory. Okay, there's no way to prove that because genes are bad and we are getting genes are not changing, so we cannot really say that genes are the problem. So that certainly begs a question: what is the different reasons? What else beyond genes that is affecting? But if we look around, I am almost 39. Maybe in the audience, somebody elderly than me or younger than me. At least in my age, we have seen the drastic change in the environment. Okay, I'm from a small little village in Punjab, where there was no technology, fairly decent quality food, etc. But today, things have drastically changed. Okay, so it is no more that we cannot just keep blaming the gene. Something beyond we had look, and certainly the environment is changing. The environment that we live under within our body, which is surrounding these genes. So this is called epigenetics. Okay, your genes and the environment around it will decide the manifestation. Now, this manifestation can be health if your environment is good. Now, if this environment becomes bad, the same genes can manifest bad health, that is disease. So genes remain fairly constant. It's only the environment is changing. But unfortunately, we are told to blame the genes. And when we are in that sort of a mode that we are blaming the genes, and we think something permanent has happened to us, and we even stop to put effort to bring it back our health. Okay. But with this information that we will be sharing with you today, we'll get the understanding what is that environment, what is that epigenetics, which is triggering this genetics to manifest a disease. You cannot change the genes for sure, but you can change the environment for sure. Okay, that is into our hand. Now, what do I mean by that environment? Okay, now all of the chronic problems that we deal with, most of the clients, okay, they have a poor digestive health, very, very poor digestive health. So poor digestive health also means the intestines not keeping well, also means the permeability of the intestines has increased, which means a lot of toxic waste that should go out of the body is going in the blood. Now that leads to a poor immune response. That is a big problem, triggering a lot of autoimmune issues. Okay. Our health depends on the kind of microbiome that we have, kind of microbes that our body is hosting onto. Now, if we don't have this right healthy guys, or rather we have more chronic infections, and a lot of chronic diseases are linked to the chronic infections. But unfortunately, conventionally we think infection means fever. If fever is not there, infection is not there, I don't need to do anything. But actually, these chronic infections are constantly poisoning our body. That is also becoming one of the major reason of rise in the chronic problems. So it's no more acute infection. Yes, there's coronas and all that acute infections, but chronic infections is a big problem. Now, our body is constantly remaking ourselves. We make new cells. Old cells will die, new cells will come. That is for the healthy function. Now, imagine if your body is poor on nutrition. You don't eat well, you don't digest well, you are poor on nutrition. You don't replace your old cell with healthy cells. That means you're running on a faulty cell. Now, that also becomes another reason. Okay. Toxic burden is increasing, heavy metal, plastics, etc., etc. Amount of toxins floating in the blood, in the tissues, is rampantly high. Now imagine a car engine with so much of carbon particles. Without servicing, you running your car for years and years. Even the best quality engine will not perform. Mileage will be down, pickup will be down, and more breakage of the engine, simply because we are not cleaning. The amount of toxins body is holding on to is just too high, and we test them, it's just phenomenally high. Now we're living in a world we're just worried. Okay, we are always worried. Now when the body is in a stress mode, body is not interested in metabolism. Body is interested in survival. When we are worried, we're stressed. We're stressed about the future and the past and all of that. We worried, and that worriness will bring down the immune system, thereby more infections, thereby more toxins, thereby a disease. Now, amount of unseen radiation around us is increasing. There's 4G, 5G, 6G. There's a TV network. There's a Wi-Fi. There is a satellite network. There is this a TV network. The amount of unseen radiation that is around us is just tremendously, constantly bombarding this physical body, and our body is not supposed to be under that. Okay, we are not supposed to be under. Imagine so many radiation. If I'm sitting in this room, I'm using my own Wi-Fi, but there are 10 more Wi-Fi radiations that I'm exposed to. Okay. On the top of that, I hardly move. I don't do so enough exercise to stimulate repair and regeneration in the body. Now, these are the problems. Not that some genetic problem that has happened to human beings and we are supposed to get sick. Okay, not like that. There's something far more beyond what we know today. But if you understand these basics, you can certainly work upon yourself. Okay. Now, our body is constantly remaking. We are constantly making new cells. Every 2 months, you get a new liver. Every 6 days, you get a new stomach lining. Every 24 hours, you get new retina. Every 9 months, you get new brain cells. We are constantly remaking ourselves. Imagine you don't feed yourself well. You don't feed enough of nutrition to your system, minerals, vitamins, fatty acids, proteins, nucleic acids, and water is missing in the system. You don't take enough of that. You don't repair. You're running on faulty cells. You're running on faulty cells means dysfunction. Dysfunction leads to disease. Okay. So when we test people, lot of people are deficit on hundreds of things, not just one or two. Even one simple deficiency can inhibit the healing process. See, we are constantly digesting, metabolizing, all that is happening. But if we don't repair, at the end of the day, we also has to repair. But if repair process is hampered, we don't repair, we don't make new cells and tissues, disease will come. Okay, now if deficiencies are there in the body, you don't repair, running on faulty cells, disease will come. Very, very simple fundamental. There's nothing very, very new to this. But unfortunately, if somebody gets hypertension, you take a new drug, but you don't see my vessels are not flexible anymore. My vessels are become more brittle. Now, to dilate the vessel, you're taking a drug. Rather, you should be doing a process to make these vessels more elastic once again by repairing the whole thing. Okay, so we really need to see now if somebody is eating good nutrition but still deficit, then you need to also see how's your digestive system. You have to eat well. You also has to digest well. Then only the food that you eat becomes your body. If you don't digest well, that's another problem. And a lot of people with chronic problems, the digestion is gone for a toss. Now, another aspect that is sort of affecting our life health is today we all eating processed foods. We're eating genetically modified foods, wheat, dairy, soya. Okay, and the main commonly absorbed eaten foods are genetically modified foods. Now, imagine your immune system is exposed to a new kind of a protein, and all the time it is triggering an immune response. What will happen? And most of the chronic problems that society has are inflammatory in nature. Okay, you eating a diet which is hybrid in nature, a new protein, and constantly triggering the immune response. Okay, our body, our human genetics are not made consume genetically modified food. So we humans are there on the earth for thousands and thousands of years, and there's a synchronization. We have been living on this earth and we are in the sync with the nature. Whatever nature has given, our body has adopted it. Not that we are some isolated beings come from outside. We have evolved on this earth, but unfortunately we have become so smarter for our own good that we modified the food. The food has become foreign to us, and immune system is acting to the foreign proteins, and immune reactions are happening and inflammation is happening. That is the one of the biggest reason hybrid food leading to a lot of autoimmune problems. Now, nutrition, if it has to be good, you have to eat well, plus you have to digest well. Your digestive health has to be good. So if you're getting a problem in the system, you look at your digestive system. If anything wrong with the digestive system, certainly you have to fix that problem. So this body is connected. You cannot simply only fix something else. If hypertension has to be get better, if diabetes has to get better, thyroid problems has to get better, this digestive system has to get better. There's no way around it. But unfortunately, we have divided our whole treatments into GI system and this system and that system, and you go to different doctors for different system, and these doctors don't talk to each other. Now there's a disconnect. You want to solve something, but you don't see the fundamental problem, the problem will persist. So gut function is for digestion, absorption, also elimination of toxins. You digest, and whatever is not required, you eliminate. But imagine somebody is constipated. All the toxic burden is there in the gut, and it can go to the blood also. It does not mean if you're constipated, the toxin will remain in the intestines. They can permeate into the blood also. Okay, if your gut function is not healthy, that also means your immune system is not healthy. If somebody is frequently getting sick, that means the gut function could be bad, and immune system could be bad, and somebody is frequently getting unwell. All the digestion also depends on the kind of microbes that are there in the gut. If we don't have this right microbes, the digestion is also hampered, thereby our health is hampered. So if anybody want to treat any problem, any systemic problem, be it eczema, be it hypertension, be it Parkinsonism, be it schizophrenia, you first has to make sure your digestive health is good. Very, very likely that there is something wrong. So, starting point of that. Now, a lot of chronic problems today, systemic problems, are due to overburden of toxins in the body. Now, toxins are coming from various sources. We eat them, you know, it come from the air also, it can come from the water, it also can come from the digestive system. If you don't digest well, the food will ferment, the food will putrefy. Now, if that is the case, instead of you getting nutrition, you start getting toxins in your body. Toxins will float in the blood. Toxins will go to other parts of the system and start affecting. Now, this phenomena is called leaky gut. Your intestines have become more permeable. They are no more sealed as it was before, so that toxins cannot pass. Now, if you have infections in the gut, if you're eating a lot of hybrid foods, if you're eating a lot of sugars, the barriers of the intestines become loose, they become more permeable. A lot of toxic waste will go into the system, that leads to more systemic problems. So any autoimmune problem, very, very likely there is a component of any allergy, any autoimmune problem, poor immune system, any systemic problem. This mostly there is a component of leaky gut. That permeability of the gut has increased. So if we have to fix a systemic problem, we have to ensure that this has to be fixed. Now, what is leading to that? This leaky gut, the poor digestive health, this increased permeability. What could be that? Could be the poor diet. Okay, we Indians also fairly squarely getting on the bread and pizzas and burgers and all of that, and those are all very, very difficult to digest foods. Gluten, dairy, grains, lot of grains we take, which might not be easy to digest for the body. If there are healthy grains and unhealthy grains, and but we are more hooked up to the unhealthy grains, genetically modified grains. Now, more sugary things we take, more infections will grow. The gut will become more permeable. Alcohol can lead to it. Steroids can lead to it. Antibiotics can lead to it. Uh, Painkillers can lead to it. Stress can lead to it. Somebody is always stressed out. Then also this leaky gut can develop, and thereby systemic problem can develop. Toxic metals can damage the lining of the gut. Okay. Parasites, fungal infections, bacterial infection can cause that. The 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 pesticide, the fungicide that we use, they can cause. So we're doing lot of things not to keep healthy, rather ulta, we are doing a lot of things to keep ourselves unwell. Then the number of problems that we get diagnosed with is, year by year we get a new label. This is your new diagnosis. This is another diagnosis. For that, you're eating another two, three drugs. But we don't try to look at why did I get into this problem in the first place. Okay, so if we develop this leaky gut, we develop more allergies to new foods. Then our immune system becomes more haywire, start autoimmune problems. Now, these autoimmune problems could be affecting the brain, that leads to dementia or Parkinsonism. If start affecting the blood vessels, can lead to cardiovascular disease. If start affecting the bones, can lead to osteoporosis, which is another one. We think it is a calcium deficiency. It's actually high inflammation. It's not the calcium deficiency that somebody is getting osteoporotic bones. It's because of high inflammation. Repair is not happening. Okay. If bone is becoming weak, repair is not happening. Repair is not happening means body is in a high inflammation state, and nutrition is low, thereby repair is not happening, thereby disease is happening. Similarly, lupus, Crohn's, and all of the other problems. You see, your poor digestive health has to improve for you to come out of the any chronic problem. For example, let's take an example of diabetes. Okay, now lot of time, lot of companies today say saying, you change your food, and blood sugars will be taken care. Your diabetes can be taken care. Yes, food definitely plays an important role, but there are other things to be done also. You cannot ignore the digestive health. If you have to make your blood sugars get better, you have to fix your digestive system. Okay, don't pick up easy answers from everybody. Make sure you understand the problem. Now, infections, when they are in the large intestine, they're called dysbiosis. When infections are in the small intestine, we call SIBO, C4. Okay. Now, these, if we have good guys, we have a healthy body. If we have infections, this is where the problem starts. Now, our immune system is also controlled or modulated by the microbes our digestive system, our body has. Now, if this guys, this which should be healthy, and healthy microbes should be there, if they're out of balance, and rather we have more infectious guys, more parasites, more fungal yeast, and bacterial species more pathogenic, they can clearly affect our immune system and can lead to development of an autoimmune problem or inflammatory problem. Now, if somebody has eczema, somebody has psoriasis, somebody has rheumatoid, somebody has Parkinsonism, somebody has lupus, somebody has pemphigus vulgaris, all of these problems are linked directly to these infections in the gut. Okay, there are other problems also they might be facing, but one of the crucial component for us to solve the systemic problem is we have to solve these infections in the digestive system. Okay, so any chronic problem, you can straight away get to that. Now, how do we improve our digestive system? First, we have to remove what could be potentially damaging us. Okay, if we constantly damaging, there's less repair happening. Net negative is happening to the body. It's a problem. Okay, so first you remove what potentially could be causing the problem. Is it a chronic stress? Is it alcohol? Is it antibiotics? Is it painkiller? Is it gluten? Is it steroids? Is it laxative, high sugar diet, or body lotion, or sunblock, or pesticide, or plastic? So many things that could be affecting our digestive system could be affecting our endocrine, which is a hormonal system. Now, if the damage is constantly happening and repair is not up to the mark, net is the poor body. Now, if we reduce the damage, repair becomes more, effectively we get health. So if we have to get into repair mode, we have to remove what is the damaging things. Okay. Sometimes emergency you have to use antibiotics, fine, but you take with the protection of probiotics. But if anybody gets a viral fever has no role of antibiotics. Okay, hardly any role of antibiotics. Actually, antibiotics can mess around with the viral fever. But we have a tendency. You get little fever, you take antibiotic. You have little cough, you take antibiotics. Please don't take so much of this thing that disrupts your whole system of microbes. Thereby, so this large number of people suffering from different problems. One of the biggest reasons behind that is non-judicial use of antibiotics, just rampantly. Any small problem, we take antibiotics without understanding the consequences. And of course, the other things which we are doing. Okay. Now, when our body is stressed out, you are worried all the time. You're worried about your health. You're worried about your future. You're worried about your past. You're just worried. When you're worried, body is not interested in metabolism. Body is not interested in repair. Body is only interested in survival. Somehow you are in this body somehow, but body is not going into repair. So if repair has to happen, you have to come out of the worries that you have. Fine, you have a problem today, it's all right. You're worried about something, is all right. Plus, don't affect this physical body with that worries. Okay, you have to come out of that. and start taking actions how to fix your problem. If we're not taking action, we're rather only worried all the time, then it's very, very difficult for anybody to help you. But if you take a charge of your own health, you understand that I have a problem, but I want to get out of the problem, and you adopt a positive mindset, then the body will go into repair. Otherwise, it just in the same loop. It becomes very, very difficult. You overeat, you eat something which is not healthy, you take more sugars, you eat more chips and all that. Basically, you become even more problem for your own self. So you have to come out of that. Another, it's just rampantly high. We work with different kind of situations, and one of the situation that we work with is autism and similar problems. My God, if you look at the test that the reports they have, this poor 3-year-old child, 4-year-old child, very high level of lead, very, very heavy metals, mercury is there, aluminium is there, barium is there, cadmium is there, so many toxicities are there. Some of them we are not even able to measure them. Okay, there could be so many other things also which we are not able to measure, but the amount of things that we measure, they also come very, very high. Okay, imagine the blood is just, instead of nutrition, toxins are floating in the blood and constantly poisoning each of the cell. If cell is poisoned, cell is malfunctioned, disease will come, abilities will lose, all of the problem will happen. But sources of this toxic could be heavy metals, could be petrochemical, food additives, herbicide, fungicide, pesticides. You see, so many problems. So many problems. Okay. But yes, you can take a charge. For example, if you using aluminium for your cooking utensils, you constantly eating the aluminium, you using non-stick, you're taking toxins from that. Instead, you replace it with the iron vessel, for example. You get iron, which is healthy for you, and you stop the toxic waste on your body. Okay. So similarly, if you have to use cleaning products, minimize that, or switch to something which is more herbal in nature. Okay. So there are options for everything that we can change about ourselves. You don't have to stick. If you want to be sick, you can stick to what you already doing. But if you really has to get back your health, you have to take a decision. Okay. This body doesn't care what is your finances situation, what is your mindset. This body needs nutrition. This body needs cleanliness inside to perform. Okay. Just like a car engine, you need to put good fuel, and you have to overhaul the car once in a while so that toxins are out and engine can perform. If you buy an expensive car, you don't take it for service, you don't take good this thing, doesn't matter how good the engine is, how good the genetics are, it still can go bad. But if you take even a poor engine car, but you maintain it well, it'll run for you. Now 80% of this body is simply water, 80% of the body. And when we test people, all the people that work with us, majority of them, they are dehydrated. Okay. Nutrition, if it has to go from the digestive system into the cell, we need water. Toxic metabolites from the cell has to come out. Hydration has to be there in the cell. Okay. Now, when we drink RO water is clean water. We need clean water, but RO water is also acidic. As compared to the pH of the body that is required, RO water will be acidic. That acidic water will steal away electron. Ability to repair, regenerate will come down. Okay. This RO water is not structured water. Ability of this water to enter the cell is very poor. Okay. This bottled water. Water is also a source of energy for us. It's not just, it has no energy. Water is also a source of energy. When I say energy, it means electrons. We are also extracting electrons from the food. Okay. Whatever we are eating, digesting, ultimately we are taking electrons from it. Water is also giving us electrons. But if you drink a bottled water, which is stored for a long period of time, it's dead water, it doesn't give you any source of energy, then that same water, which could have been better for us, it becomes bad for us. And lot of the chronic problems is also due to body is dehydrated. When cells are dehydrated, they don't perform. When they don't perform, you get headache, asthma, colitis, diabetes, heartburn, peptic ulcer, all of these problems. Okay, these are different manifestations. Fundamentally, if your system is doing okay, you keep health. If your system is not doing okay, various problems can arise. Another thing that is, our body is supposed to be under bright light, sunlight when it is daytime. When it becomes evening, we should not be under bright lights, or ideally we should be under darkness. This is nature has built for us. Now, when the light falls onto this body, we get a signal, it falls into our eyes, that it is a time for metabolism. We have to start metabolism. So we eat our meals, we digest our meals, we run around, we do all the activity, we do all the thinking. Now, after sunset, no light falls on the body, no light falls into the eyes, means it's a time for us to repair all the activity we have done. We now has to repair our cells. A lot of biochemical, mechanical processes happening in this body. Those has to go into repair. Okay. Now, even if after sunset we are sitting under tube lights, LED lights, bright lighting, our body doesn't get a signal for repair. Okay. If repair is not happening, we're running on faulty cells, dysfunction is there, disease is there. Okay. Just you being under poor light, you calling on diseases. You want more disease for yourself. So it's very, very simple, but very, very fundamental and very, very true. Another thing, which is, all of us, somebody is taking antihypertensive, somebody is taking something for cholesterol, somebody is taking for diabetes, somebody is taking for pains and reflux and all of these things. Now, I said, if you have to repair your body, you need nutrition. But if the drugs you're taking are depriving you of the nutrition, okay, minerals and vitamins, you take a drug for something good to yourself, but those drugs will deprive you of certain nutrition, then your ability to repair will go away. You become more into problems. Now, you take something for good, you end up into bad. It is, for example, if somebody takes diuretic, it can deplete B1, B6, vitamin C, magnesium, calcium, potassium, zinc, and sodium. If somebody is taking cholesterol lowering drugs, okay, that's another big problem that is happening. It can itself can deplete your fatty acids, and fatty acids are a fundamental requirement for the body. Okay, metformin can also deplete B9 and B12. Now, metformin is good guy, but you has to ensure that B12 and B9 keeping okay. Similarly, painkillers can deplete your B9, B12. Okay. So likewise, there are classes of drug and depleting certain things out of the body, thereby repair and the function of the body is depleted. Thereby, there is a problem. Okay. You need to be careful. Today, doctors are busy. Nobody has time to talk to you and give you all that explanation. All they have time for 2 minutes. You have a lab reports with you. You go to them, they look at the lab report, they give you a prescription. They don't have a time for you to tell all of these things. They might be knowing all of these things, but they don't have time. So all of us has to become aware. This is what is wrong with me. This is what I should be doing for myself. You don't let anybody else decide for you. You also has to become participatory in your own health. You no more can just rely on third party. Yes, we as doctors, healthcare professionals can make a plan for you, can tell you what is wrong. You have to choose the right doctor, of course, but then still you are responsible for your health. You cannot let be that into other hands. You have to become more aware and uh, conscious about your own self. Now, please stop blaming the genes for every problem. Okay, rather start thinking about the epigenetics, the factors which are around the body, within the body, around the genes, which are affecting whether The health should come or disease should come. Okay, it should be proper ingredients, the raw materials that this body needs, a positive environment, a non-toxic environment that is required for best expression of these genes. Okay. Now, if we put all the nonsense in this body and expect that we will have a good health, it is not happening. Okay. You don't sleep well and expect good health, it's not happening. You expose to 100 Wi-Fi's at a time, you keep 10 phones with you, you don't keep these things in your pockets, and you expect that your testosterone will keep high. Don't expect that. Okay. So if you want to get healthy, you should become empowered. You understand about the problem and take a right action from any guy that you want to work with. Okay. You should be knowing what those guys are doing, and you should be trusting those guys and work with them, and you certainly see that things are working. Okay. Don't wait till everything is gone bad, and then it becomes more difficult. The moment you start feeling something is not right, take right help and start fixing. So it's less fixing required. But by the time you wait, and things become much more aggressive, then they need much more longer period of time to repair the body. Body will still survive and survive and survive. The optimal health will become less and less and less. So to make the optimal health to topmost again, lot of work to be done. Okay. So we cannot change the genes, but certainly we can keep them happy by keeping the right environment. Okay. Now, how you feel in the body depends on the biochemistry of the body, and the biochemistry of the body is also decided by the nutrition. If nutrition is missing, biochemistry is bad, you feel bad, you have pain. Okay, growth and repair and regeneration are all hampered. So at least start eating well, stop hybrid foods, eat organic eggs. If dairy, when a chronic problem is there, don't take it at all. If at all you still want to do it, organic. Okay, stop sugar foods, processed foods, junk, alcohol, etc. When you're healthy, if you put little alcohol, you will not feel any problem. Your body can tolerate the nonsense, which is okay. But when you're unwell, you have to do more healthy things, less unhealthy things. It's not a restriction for life. Okay. If you're healthy, mess around a little bit, it's all right. But you are unwell, you still mess around, it's very negative. Eat more organic produce, more healthy fats, eat more anti-inflammatory herbs, which can help you curb down your infections, turmeric, cumin, fennel, parsley, cinnamon. So many of things, especially in India, we have so many of these things. Okay. Now, when it comes to nutrition, you can test. You can test and give what is required. Is it protein? Is it fatty acids? Is it minerals? Is it vitamins? Is it phospholipids? Whatever is missing in your system, please feed it to your system so that your system can do well for you. Okay, just like a car. You don't put the fuel expected to run for you, it is not happening. Same with the body. Very simple. Now, we are living in a world where mitochondrial activity is already poor. We are not fully hydrated. Our nutrition is poor. Our repair and regeneration is poor. This blue light is constantly affecting the mitochondria. The Wi-Fi, etc., is affecting the mitochondria, which means more damage is happening, less repair is happening. On the top of that, there are certain nutritionists saying you can eat like nannies and grannies and all of that. You can still eat white rice. See, to consume the white rice and make energy out of the white rice, you need a healthy mitochondria. But today, the problem that we don't have a healthy mitochondria anymore. The mitochondrial health is deteriorated. That is called metabolic health. Okay. So if your mitochondria is healthy and you take white rice, no problem. If your mitochondria is getting a lot of damage because of so many things happening around us, because of the technology and the toxins, etc., you need to feed yourself more fat and proteins to repair your mitochondria so that you can consume these carbs. So when a nutritionist tells you you can't eat your like your nannies and grannies, it's not right. They don't know what they are saying. They're just confusing us. Okay. So eat more fat and protein so that you can repair your system. And structurally, we need more fat and proteins. Carbs are not a structural part of the body. Okay. Very, very simple, but very, very, effective. You need to do some level of exercise to stimulate mitochondria, to stimulate good, healthy gene expression. So high intensity exercise is a good one. Okay. Involve your large muscles. For example, squatting is a good one. Okay. Do high intensity interval exercises. You run very fast, take a break, run very fast, take a break. You stimulate, you put yourself in a little bit of a stress, then rest, little bit of a stress and rest. That will stimulate the mitochondria. That will still stimulate good gene expression. Like I said, circadian rhythm is very, very important. Sleeping is very, very important, which means when the sun comes up, you go outside. When the sun goes down, you stay under dark, less light. That allows the body to repair. 10 to 2 p.m. is the time when you repair. If you sleep at the right time, you repair at the right time, you keep good health. Amount of toxins coming to our body is just phenomenally high. Liver is the guy doing a good job for us to eliminate the toxins. Okay. Make sure your liver is doing okay. Now, this fatty liver problem, it's not because of the fat that you're eating that you have a fatty liver. Okay, it's an inflammation of the liver. Just like we become more obese because of the inflammation, not because of the fat. We become more obese because of the inflammation. If you test your inflammatory markers in an obese person, it will be high. Similarly, this fatty liver is not a fat problem that you eat fat and you have a fatty liver. It's because of the inflammation. There's a toxic burden on the liver, and that is leading to the inflammation in the liver. That's why this poor guy is increasing in size. So make sure you detox your liver. Make sure you reduce your toxic burden so your liver can come to normal shape and function. And also detox your surrounding. Okay. Detox yourself. Use personal care products or cleaning products which are more safer. Okay, do some infrared sauna for your own self. Connect to the nature. Grounding is very, very powerful. Very, very powerful. Some Epsom salt bathing to give you more magnesium and take out your toxins. Very, very basic things I'm saying. Good light, good water, good food, detox yourself. And of course, if you need any practitioner help, you can certainly seek for that. Test yourself what all your system is missing into. You feed yourself those things. You clean out your infections. You will get your body back. You will get your health back. It's not very, very difficult. Now, sunlight, we humans are supposed to be under sunlight. Just like any other animal, we are also supposed to be under good amount of sunlight in the daytime. But unfortunately, it's not happening. We are living in the concrete jungles, and inside our houses we hardly go see the sun. At least to replace that little bit of a sunlight, you can buy infrared light panels and expose your body to the red light generated by these red light panels. Now, first priority is the sunlight. If you cannot do sunlight enough in the day, you can have a red light panel 20-30 minutes in a day. You're still good to go. I don't say it's a replacement for the sun, but you still mimic sun of something like sun. You still keep your health good. Very, very important. Okay. So these are some of the fundamentals I wanted to share. Nothing that we are suffering is coming from outside or because of genes and all that. It's all, what we are exposed to. And certainly we can work around it. We can open to the questions.
Thank you, Dr. Ashwani, for summarizing the key root causes and some simple solutions to address at least for people to get started. So we will open up for questions. Those who want to ask questions, please raise your hand and our team will assign you a token. So Prachi, you can unmute yourself and ask your question.
Sure. Thank you, Dr. Ruhi. Hello, Dr. Ashwani. Sir, my daughter is doing her second continuity plan with FM. So it has been almost 1 year with FM, and she's autistic. So, so I wanted to understand whether there is any specific diet and modification or medication plan for me, because we wish to plan for another child. So I wanted to understand if there are any specific protocols or any specific program for this, like how it is for autism.
Right, right. So again, always we hardly seen that a child is autistic from the birth. It's always a regression. Most cases,
Right,
regression. Now, when some mothers come to us for their own treatment after they realize that their child has. Now, when we test these mothers might have some autoimmune problems. Mothers also might have some toxicities in them. Mothers might also have some infections. Same infection and toxins are leading to the autism in the child. Okay,
right,
unknowingly. Okay.
right.
So certainly, Prachi, we run a program called Hormone Reset, where a similar program more focused on women health, where we do the similar process, test you, find out, help you
Hmm.
eliminate, make your body more conducive for a healthy pregnancy and a healthy child.
Right. Because if during our introductory session, I remember you saying that these days acid tablets are given, whereas folate should be given. So these are the tiny details that I'm looking for. And along with my daughter, we have also done a lifestyle change, because if she has to be on the diet, even we have to be. So I can definitely see huge improvements in my own health. So that's the reason I wanted to go for a more personalized plan where these things are focused. So that's the only thing I wanted to understand.
So
Sure, Prachi. We will
Prachi,
share details.
yeah. So to add to that, so we have many mothers, in the hormone reset program whose children are already enrolled with the learning disorders program.
Right,
And
right.
we can see the correlation, when we test the mothers,
Hmm, hmm.
heavy metals that the child have, it's also
Hmm.
present in these mothers. So you can also see
Yes.
where they're coming from.
Right, right.
So
It
it's
may help her as well in turn.
absolutely, so it's very important that the mothers, check for all these if their child has a trouble, so that, and especially if you're planning for a second pregnancy, it's very, very important you prepare your body for a healthy pregnancy.
That's right. And in fact, I must take this opportunity to thank FM, because the improvements that I've been seeing in her is the only reason I can really come up with this question. Otherwise, there was no question of even thinking for another child. But the way she is progressing, I can definitely see huge progress in her. So I would like to thank FM team
No, no,
for that.
we should thank you, Prachi, for the efforts that you put.
Yeah.
Okay.
I mean,
I think, like I said, we can give you the plan and protocol, but at the end of the day, it's a lot of effort from a parent side, and where if a parent is putting that effort, then only outcomes are coming. Okay, so
Definitely, yes. I
so
mean,
we
she right now she can not just read, like when we before we started with FM, she could read, but these days I don't have to teach her. Like she solves grammar that is meant for people who go to Canada. They give these English exams, TOEFL. All those grammar tests she solves, and I found only 3 mistakes out of 50 questions that I gave her. So that is how well she's progressing. So
so
yeah,
it's really
thank
wonderful
you very
to
much.
hear that, Prachi. Yeah,
Yeah,
all the
thank you, thank you.
yeah, thank you. Okay. So, Tushar, you can unmute yourself and ask your question.
Yes. Good evening. So my question is that can we deal with Sjogren's syndrome? with the help of this program, which is oral Sikka basically?
So that's another autoimmune problem. Like I said, doesn't matter what is the manifestation. Autoimmune problem is a systemic problem. It's a problem in the immune system affecting different organs. In this case, affecting the salivary glands. So if you calm down the immune system, this problem can also be taken care.
Okay, makes sense, sir. Thank you.
Okay, thanks, Tushar. Um, Ilakia, you can unmute yourself and ask your question.
Yeah, thank you, doctor. It was very useful. I came for education purpose only, but I really wanted to ask it for my friend. He is currently dealing with narcolepsy type 1, so which we have understood is also an autoimmune disease, like it's a localized inflammation in hypothalamus. So that's what we have, at least like until now, we have read and we have understood it. So how do we approach that? Like is this program will be the right things, or how do we should approach you on regarding narcolepsy type 1 patients, especially with it has progressed to status cataplecticus, and it's like the drugs or the conventional allopathy drugs seems to have a lot of side effects. So we are looking for functional medicine approach towards this kind of
So again,
sleep disorder. Yeah, yeah.
Now this is an inflammation in the brain, or whatever part of the brain.
Okay, okay,
Inflammation can happen in the brain only if body is inflamed.
okay, okay,
There's a blood-brain barrier. If that is also broken, then this is where. So if you have to make this part healthy, we have to make this part healthy.
okay,
But
okay,
set of rules remains same. Okay.
okay, okay.
Have to make your repair more better, damage more less, create those right conducive conditions. So we humans are not smart than this intelligence of the body. Some
Right.
intelligence has made us. And if we tend to be trying to be smarter, then that's a problem. But if we use the smartness of the intelligence of the body, this body is meant to be repairing, self-repairing system it is.
Right, right.
All we have to do is create the best of the conditions that we can do.
Okay, okay. So I can, yeah. So I can approach your the clinic regarding this, and we can take it further.
Certainly.
Okay. Yeah, sure. Thank you.
Thank you. Anamika, you can unmute yourself.
Hi, doctor. Thank you so much for the insightful session. It was really wonderful knowing about it in details. So I'm about to start my 3-month program. And I talked to you over a phone call, and the main problem that I'm facing is related to my actually it's gut issues, but it is manifesting a lot as uh, chronic fatigue and brain fog and disassociation, all these symptoms which are very weird. So my question is just out of curiosity, because I'm already about to enroll for the 3 month program, so I'll be working on that. But just out of curiosity, I wanted to know a bit, because I'm very intrigued by it. So why is it when we are having a gut issue, why is it manifesting so heavily in the brain, like, and even migraines and all these issues, like it becomes so debilitating that it becomes difficult to even go about your day. So just out of curiosity, I'm asking this.
Right. So one by one, we try to address that. Now, one situation called brain fog. Okay, you cannot think clearly. Now, simple thing that we can correlate is something called microbrewery syndrome, which means you eat white rice, you eat sugar, you eat any refined thingy, and the microbes in the gut, especially fungal infection, will turn it into alcohol. Brew your own alcohol. That alcohol will go into the brain and make you foggy. Not that you have been drinking, it's just the infection. This thing. Similarly, now we work with a lot of because we work with so many diverse situations, and every situation will teach us something. Now, all of these children with autism, they tend to remain zoned out.
Right.
Some they're in their own world, dissociated. What you mentioned.
Yeah, that's what happens with me.
Right. So some of the fungal metabolites, the byproducts of the fungal infection are close to opium.
Oh God.
Okay. So it's not that you are doing anything about it. It's
Yeah.
just you eat something. Instead of you eating that food, some microbes are eating that, which are unhealthy, pathogenic. They convert the food into something waste. Either microbial waste can become good for us, or it can become poison for us. And in this case, it is becoming poison. That is acting something like opium and causing that feeling of the dissociation. So slowly, as we clean the system out, you feel much better. Yes, during the cleaning process, there could be a little bit of detox and die-off reactions and some exaggeration of the problem, which is temporarily. If you know that this is going to end, it will end for you. The problem will get better and better and better.
Right. So this can happen even with a fairly clean diet, because like I don't eat fast food or even processed sugar and dairy and all that. Like I've been on a pretty clean vegan diet for years.
Right.
So it can happen even with healthy foods. Is
Right.
it?
So it's like animal, like I said, the car has 4 tires, for example. The 4 tire has to do good, then only car will run. Now,
Right.
when we change diet, it's a first step. Then we clean infection and reinstall healthy microbes, another step. Heavy metals, body doesn't have the ability to move all the toxins by itself. Until toxins are out, immune system is not getting better, microbiome is not getting better.
Right.
Okay. So removal of these toxins is very, very important. Now nutrition needs this thing. Now veganism, see, you might be off gluten, you might be off dairy, you might be off this thing, but we have worked with non-vegetarians, hardcore carnivore. We have worked with hardcore vegan. Both cases, amino acid profile was very, very poor. Okay. It's a choices of food that we take. You can be vegan, still eating the best of the food, or you can be vegan, still eating the worst of the foods. No, all I'm saying, not that I'm pinpointing, sometimes the markers will clear the picture, what really we
Right.
want. And this body needs what it needs. Okay. It doesn't care about my religion. It doesn't care about my faith. It doesn't care about what sort of I'm following. It just need what it needs. And our responsibility is to give it. I'm a vegetarian, but if I, by a choice, deprive myself of something, it's my choice.
Right. Thank you so much, doctor.
So, Anamika, to add to that, whatever you're going through, we are seeing this very common in our practice today. So many, young population is coming with problems like yours, right? And because of this, the productivity has gone down dramatically,
Yeah.
right? But if you put in consistent, focused effort, you can come out of it.
Yeah, that's what I'm looking for actually. I've been suffering for so long that I had lost hope. But then I found a functional medicine clinic and I enrolled for this. So yeah, looking forward to it.
Sure.
Thank you.
Thank you. So before we move on to the next question, I request all of you to please answer the poll if you haven't. All right. Arun, you can unmute yourself. It would be good if you can
Yeah,
turn on your camera.
ma'am. Hi. Hello.
Yes.
Yes.
Yeah, can you hear me?
Yeah.
Yeah. Good evening, ma'am. Actually, I have enrolled for 3-month plan, and I'm about to start by next month starting. I have been been in touch with doctor, and they have been updated me with some certain plans, nutrition, like supplements, everything. And the main thing which I right now facing is like I used to have physical activity each and every day, but like past 3 to 4 months I have been affected from I have been injured in my left shoulder, and went and met a doctor in Manipal, and he suggested me for a steroid shot, and I went for physiotherapy, and still now the recovery has not been done. It's not 100% done yet. And again I go meet a doctor, again they're suggesting me for a steroid shot in my bike. They're telling that it's a inflammation happen in the by area. So like in this plan, will I be able to overcome this problem? Like, should I consider it something else, ma'am?
Right, Arun, so definitely our process will help you reduce your overall inflammation, thereby that the inflammation specific to the area will certainly reduce, and
Okay.
body will be given enough nourishment to get into repair. Now, another thing, like
Okay.
I said, repair also depends on the metabolic function. Metabolic function is also triggered by the sunlight or red light. If you take more red light, then also more repair will happen.
Should I focus on the specific area, sir, for the red light, or
Yes,
like
yes.
overall body,
Yes.
sir?
When you're having a pain, you focus on the pain also.
Okay, because like continuously I'm having pain when I just use the hand. If I raise my left hand above my head, at one particular point of motion, I have pain. Other than that, it's fine. So
Right,
due to
right.
this, I'm not able to have physical activity in my life. It
That's
is like kind of
yeah,
like it's a disturbance in my life.
no, so Arun, what at least you can do, spend more time in the sun, walk around in the sun, get yourself grounded. So basically, any injury, you have to increase your repair mechanisms.
Okay.
Okay, for
Okay.
that,
Okay.
nutrition, sunlight, grounding, good quality water. Along with
Okay.
if it is a real problem, once in a while, the steroids temporarily will, give you a pain relief till your body recovers from it. So that is
Okay.
okay. But
Okay.
at least to walk around, basic. It's okay. It's not necessary that you have to lift weights. It's okay. Just
Yeah.
basics.
Okay, sir. Like, and followed by this injury, I had like a very chronic coughing for past 1.5 months. Right now, I'm quite fine. I had chronic coughing, and with this thing, I went and met to the lungs doctor because I was a smoker past. I had a history of smoking. I went and met a doctor, and he suggested me for inhaler shot, steroid shot, inhaler.
Inhaler. So again,
Yeah, okay,
what
yeah, sir. Like, let me finish it, sir. Let me finish it. So what happened is after I was using this for like 14 days, and I have been diagnosed with CSR in my eyes. CSR. And
Yes,
when I went and met an eye doctor, he's telling me it was due to this steroid shot. Right now, cough has reduced, but still there is itching in my throat, and this CSR problem in my right eye is still being affected.
right.
Like, will
So
this?
actually,
Yeah.
yes, it's an inflammatory process. This eye problem is also because of inflammation. So your retina is inflamed. Okay.
Okay.
As the overall inflammation will come down in your system, that problem will also get better.
Okay. Okay.
So
Uh,
yes,
yes,
follow
sir. This 3-month plan will help me out with this thing, no, sir. Like, or should I stick on to something? Like, should I add on something else into my lifestyle or something else, sir?
whatever. See, this plan will be lifestyle. This plan will have food. This plan have everything necessary for it. If emergency you need some treatment, it's all right. Okay, you can continue till
Should
you
I
get
continue physio, sir? Should I go for physio, sir?
certainly you can do that.
Okay, okay, sir. All right, sir. Thank you so much.
Okay, thank you. Revati, you can unmute and ask your question.
Hi, doctor. So
Can you-
actually,
Can you turn
this is
on your cam?
right now I am outside, so I'm not able to go. So is it okay?
Oh, go
Yes,
ahead.
ma'am. Yes.
Actually, I already spoke to you, and also I want to enroll my daughter on this program, 3 months program. She is 11 years old. Right now, she is having like multiple food allergies. So as per my understanding, she is facing like histamine intolerance and salicylate intolerance or mast cell activation syndrome. I'm not sure, but she is having like multiple kind of allergies. The suspect is on these issues. So I would like, before enrolling the 3 months program, I want to understand like whether you have faced these kind of problem. Will you be able to rectify this one? I want to understand. Also, I have order for the air mineral test and NutriFit test as per your suggestion. I have ordered it. I'm waiting for that one. So
right. So now more histamine reactions are happening because of infections and leaky gut. Now, when you clean the infections, leaky gut is resolved. A lot of these food allergies and high histamine problems will come under control.
Okay.
So I'm certain that it will be taken. Yes, we have worked with so many other people.
And additionally, she's having salicylate allergy also. So aspirin, ibuprofen allergy is there. So which contributed this also. So the plant-based food, she's not able to tolerate it. So in this program, the diet will be given based on or whatever ability can be able to provide it.
Yeah, we'll look into it. Whatever is that, based on that, we can try, devising a plan.
Okay, doctor. And also, do I need to wait for the result to come before to enroll the program, or can I enroll it and then let the results come? How it should be?
Whichever way, as suits you.
So, Revati, to start with the treatment, we at least need the blood work. So, if you have the blood work, we can get started with the treatment. And when the other reports come, we can update the treatment plan.
Okay, doctor. And also, last question. So it's like anything like immune disorder and then gut health issues. So, right now we are addressing gut health problem. So suppose if it's in the immune disorder problem means how it will be achieved. So
Actually, immune disorder is happening because the gut is poor. If you make the gut health poor, better, toxins better, immune system will calm down and function normally.
Okay. Okay, doctor. Thanks for your response and answers. Thank you, doctor.
Okay, thank you. So I'll answer a question which is there in the Q&A. So Arvis is asking, can I be located in Europe and enroll for 3 months program? So yes, Arvis, location does not matter. You can be in any part of the world and get yourself treated with us because all our consultations are done online and the test can be made available wherever you are based. So location is not really a concern. All right. Swati, you can unmute yourself. Swati, you're there?
Hello.
Yes, go ahead.
Yeah, doctor. I wanted to ask, like, my mother, she's now 59 years. She's been detected with this obstructed hernia. So, does this also like require a surgery? Because we went to a doctor and they were like, this requires a surgery. So, I had a doubt whether hernia be treated at that age with like functional medicine or it requires a surgery.
So which part of the, is it umbilical or which inguinal, which?
It's near the pelvic bone, just next to the pelvic bone. Yeah.
See again, the hernias, if it has become obstructed already, so basically sometimes it goes in, the intestines goes into the inguinal gland, comes back, goes in, comes back. Generally, this happens if somebody is constipated for a long period of time, intra-intestinal pressure has increased. That leads to the movement of this intestines going somewhere here and there.
Okay.
Now, it is not an emergency. Okay, as per doctors, it's not an emergency. That means you reduce the constipation, slowly intra-abdominal pressure will come, and you improve the nutrition, muscles, and those things will get better. Okay. And temporarily you can put a belt and all that to hold on to, for example, in inguinal hernia, there are inguinal hernia belts available. So if it is a temporary situation, but if needs surgery as per the doctor, then best you do the surgery. But after surgery also you still need to fix the problem. Okay.
Yes.
To make the digestive system better, so that constipation is not there, so that it does not reoccur.
True. Okay, doctor. Thank you so much.
Okay. Farah, you can unmute yourself.
Hello, good evening, doctor.
Good
Yes.
evening.
Yeah, I had a simple question. Like I've been dealing with cervical spondylitis for almost 3 to 4 years now. So I just wanted to know that is it related to this inflammations and gut issues or something like that?
So spondylitis means inflammation of the spine because the inflammation is start fusing and all that. So ultimately, it's an inflammatory problem, and it could be linked to the gut. It could be linked to other infections and toxins, etc., etc. So at the end of the day, if we work on the inflammation, then that part can be taken care.
Oh, okay. So because I've tried allopathy, homeopathy, physiotherapy, everything for in last 4 years, and for meanwhile it gets solved and gets back again.
Right.
So
So you are
this will
again, inflammatory triggers are continuing. The problem is continuing. Now again, let's understand this. All pathies has a role to play, but then depending on the kind of doctor you are deploying, either see that 4 tires, maybe somebody is working on only 3 tires, somebody only doing 2 tires, then something is still missing. That is
okay.
where the failure can happen. So if we go very, very aggressive, very, very thorough, I am certain that it will be taken care.
Okay. Okay, fine. Thank you so much, doctor. Thank you.
Okay, so we'll take last two questions. Anshul, you can unmute yourself.
Hi, good evening. Sorry, I'm not able to come on the video. My question is related to hypertension, right? And how is that linked to the autoimmune reaction or response? In my case, I have had hypertension. I'm 47. I've had hypertension diagnosed at least for the last 2 years or so. I exercise fairly regularly. I diet wise am like to believe generally quite healthy. In fact, for 2 months, I also experimented. I gave up all wheat, gluten, dairy, lactose, everything, and didn't really help the hypertension situation. It helped my other things like the HbA1c, etc. came down. But so that was my main question on what is the linkage between really immune response or autoimmune response in hypertension.
So hypertension primarily means your vessel wall has become more hardened, more brittle. Okay, it's not able to relax as much as could have been doing when probably we are more younger or when we did not have the problem. Now, this hardening of the vessel could be many reasons. One simple reason could be if you don't take enough salt. Okay, when we are told to go on low salt diet, when we go on low salt diet, we reduce our sodium, thereby we reduce our plasma volume, thereby the pressure on the vessel will go high, low, thereby the pressure can become better. But when we go low salt, we go low sodium, the calcium deposits become more, thereby brittling become more. That is one. Now, if inflammation is there because the gut issues and infections and etc., then also this wall can become more brittle. Or if repair is not happening, then also this wall can become brittle. If magnesium is deficit, the muscles of this vessel will not relax, then also this can become more tense. So thereby so many mechanisms, because of that this wall has become brittle. We really need to, if any toxins are depositing there, then also this can become brittle. So we really need to see what all sort of issues and we fix them. If any soft tissue calcification, we chelate it, and I'm certain you will come out of that hypertension also.
Okay, thank you. Yeah, I'll be signing up. I have taken all the tests and
Sure.
we look forward. Thank you.
Sure. Thank you, Anshul. Okay, we take the last question. Preeti, please go ahead and unmute yourself.
Hi, doctor. Am I audible?
Yes, ma'am.
Yes.
Sorry, I'm not able to switch on my video right now. So I and my husband have signed for the 3 months program. So just curious to know what shall we expect out of it, doctor?
I think I've spoken to you. Your hubby has psoriasis, it'll go away. Psoriasis 100% taken care. Okay. The second is about, becoming parents. I'm certain you will become healthy, your hubby will become healthy. Your chances of pregnancy and holding on to good pregnancy and thereby getting a healthy child will happen.
Okay, thank you, thank you. Those are big words because we have been fighting infertility for close to 10 years and we were termed as unexplained. So we were looking for reasons everywhere in the world and we have finally landed up here.
No, I'm
So,
certain.
Preeti, we have had people coming to us who have had failed IVF, okay, and with multiple health problems like autoimmunity, poor gut health, you name it. I mean, the body was loaded with all these conditions, and they were trying for IVF. You can't expect the body to conceive, right? The body is inflamed. You cannot expect the body to harbor a new life when the body is so loaded with toxins, etc., inflammation, right? So when we started cleaning up, we addressed what was wrong in the body, and it took us 6 to 8 months, and one of them, she conceived naturally with twins. Okay, there was
Wow,
another
that's
one who
amazing.
had been trying for so many years, and she conceived again naturally. So there are cases like this, many cases like this, where they, after they worked on their health, they were able to conceive naturally.
And one of them, she was in Dubai. She was 44.
Yeah.
Wow.
So
That sounds great.
see, not that we don't have any magic pill. It's just your body has to do the job. Your mind has to do the job. We can only put up a plan.
Thank you, doctor. Thank you.
Yeah. Okay.
Okay. Let me see if there's any unanswered question. So Padma is asking, is there a WhatsApp group for all patients out here? So Padma, yes, we do have a community which you can join. Dr. Meera has shared the link to the community. Megha is asking, is there any blood test which can indicate gut inflammation?
Yes, calprotectin is direct way to know calprotectin. Sorry, inflammation. But definitely, if there's bloating, there's constipation, there is any symptom, you can expect that something is going on.
So, okay, I think we've covered all the questions. So thank you everyone for joining us today.
This Avasti ji, last question probably.
Okay, what's the question?
Avasti ji, yes.
What's the question?
Hi, sir. Hi, sir. Hi, ma'am.
Yes.
And my question is a bit off topic, more on the educational side, ma'am. Actually, I've completed my MBBS and I was looking into a different course about, holistic, where you can incorporate everything, and that is how I came across Ashwani sir's program for autistic children. My interest of field is pediatrics, so I joined the program. I've joined sir's 3 people's program, Ashwani sir's program, then one lifestyle chronic reversal disease program, and Preeti ma'am's program. My question is, I know it's off topic, but if somebody can help me how to actually become a functional medicine practitioner, it would be really.
So
I completed my MBBS, sir.
Yes,
So
we speak, Dr. Swati, and so we are glad that you want to be one of us. And certainly there are ways. There's no fixed rule to the game. The moment you understand at least we realize that there is a drawback into what we do, that opens up the channels within us, and the information will float to us. It's not difficult. Okay.
Okay.
What you're doing is fantastic, and of course, there are in US there are, since you are MBBS and you want to, you're already a MD doctor with pediatrics. We are not so educated, by the way. We are less educated than you. So there are good courses.
No, sir, I've only finished my MBBS, but I want to pursue actually pediatrics. But before that, I came across this, and I thought this is even better than what we actually study in. Especially, I attended your workshops and I enrolled your program, even though there's no lag or anything with my baby, but I just want to know what it is about. So I enrolled your 3 months program. I'm still there in the batch 26 of disability program.
Sure.
So I follow all your videos and everything and take notes. But again, my question is how to actually become a certified practitioner.
Yes. So kindly ping us at functional medicine clinic number. We will guide you.
Oh, sure, sir. Thank you, sir. Thanks a lot, sir. Thanks a lot, ma'am. I've even seen your hormonal reset program. So I keep watching videos, but it's like, I don't know whom to approach.
Sure, you can reach out on
Thank
the
you, sir.
clinic number and we will guide you further.
Yeah, sure. Thank you, ma'am. Thank you, sir.
Okay, thank you. Okay, I think there was one question about aero water. What's your thoughts on aero water?
I think, Padma, this is something that from the air, they create water, right? The moisture is basically condensing the moisture from the air and turning into water, right? Now, I think whether that water is great depends on the quality of the air also. Along with the moisture, we might capture a lot of toxins also. Maybe we need to filter water.
Yes, that was my question about the aero water. Can you hear me?
Yes, ma'am.
Yeah.
Yes, Pamela. So I think
You
that
are muted, Pamela. Can you unmute yourself?
Sorry, I think something. So, ma'am, I think what I understand from air water, if I get it right, is some water that we make from the condensing the air moisture. Is that the one that you? No. Okay. So please try to unmute, ma'am. If you can unmute.
Mute. Hang on.
Yes.
Ah,
yeah.
Now it's unmuted. It's the water. It's a water filter, reverse osmosis water filter.
Right. Okay. So now reverse osmosis can clean the water.
Yes, but it cleans everything, no?
Yes. Now, when we're living in Bangalore, we need RO water, but one simple practice can be done is you take your RO water in a glass bottle.
Put it in the sun?
And also add some pinch of salt up before you drink.
Pinch of salt. Okay. And keep it in the sun, huh?
Yes.
So you add the salt after sun charging. So once you kept it for 3 hours, and then you take it, and then before drinking, you add some rock salt to it.
Okay, I have been putting in the sun, but I haven't been adding salt. Okay, great. So I'm in the dark because it's 2 o'clock in the morning in Melbourne, and people sleeping in the house. But I had a meeting with you on Thursday, but I was traveling from India to Australia at that time. So I would like to set up in the next few days when you're free to have that meeting.
Sure. So you can actually reach out on the clinic number.
On the clinic number.
Yeah, and the team will set it up, based on mutual convenience.
Okay. And when I get back to India, I want to do the 3-month program also.
Sure.
Yeah.
Thank you. The plan that we've given you, right? That's already meant 3 months. So
yes.
For a way you can already start doing that. And then when
I'm starting, yeah.
Yes.
It's a little difficult while I'm traveling, but I'm just cutting out the main things and I'll actually start on the plan when I get back to India.
Sure.
Yeah, very interested. I've been following on about the microbiome and mitochondria and everything online now for a long time. And I was so happy that there was one in Bangalore,
Yes. Thank you so much.
Thank you very much. Yeah, it's quite close. I live in Tiruvannamalai. It's not far.
Yeah. So you might be knowing Mr. Cohen.
Mr. Cohen, yeah.
Yeah. Okay, that's good. We have met him once.
You've met him. So one time, if I come to Bangalore, is it possible to have a personal meeting, or is it only done online?
Yeah, we mostly do online work, but yes, you're welcome to Bangalore, and we certainly should meet, not as a doctor to as a as a experienced person to a non-experienced person. We'll meet and learn something from you.
Right. Okay, whatever.
Yeah, Tirunelveli is also something that we want to visit that place. We've heard a lot about that place, so that.
Tiruvannamalai.
Yeah, yeah.
Well, let me know if you come there.
Sure.
You have my information. Let me know if you come. I'll take you around.
Sure, absolutely.
But I will be in touch, hopefully, in the next few days to set up a meeting.
Sure.
Okay, great. Thank you.
Thank you.
That was very interesting. It was all the things that I've been learning about. You covered. So I'm so excited that there's a functional medicine clinic in Bangalore, in India, in Bangalore. Really, my dream come true, because I really was looking for one.
Thank you.
I came to Australia thinking that I'd find something in Australia, but they don't. I don't seem to find anything here
Yeah,
yet.
I think in Australia also there are people like us. I think
There must be, but it's not so easy to find. I couldn't find online.
Okay.
But anyway, thank you very much. It was a great meeting.
Thank you.
Okay.
Okay.
So,
Thank you.
Yeah, thank you everyone joining us on a weekday. And we will be coming up with more informative workshops like this in the future. So we do have a community. You can join that, if you want to keep yourself updated. We do have a broadcast recipient list. So if you want yourself to be added, just message on the clinic number and we will add you to the broadcast recipient list. So thank you again, and we'll see you next time in our next workshop. Thank you.
Thank you, Sindhuji. Thank you, Sindhuji, for spending time.
Yeah. Thank you.
Thank you.
Thank you, sir. Thank you, ma'am.
Thank you, sir. Bye-bye.